Have you ever felt a peculiar sensation in your legs while sitting? A feeling that just wouldn't go away, leaving you with a nagging unease? Many of us dismiss these subtle signals our bodies send, attributing them to simple fatigue, a cramped position, or the natural aches and pains of daily life. But what if one particular sensation, seemingly innocent, held a far more serious warning? Imagine Martha, a vibrant 72-year-old, who loved spending her afternoons knitting in her favorite armchair. One day, she noticed a persistent dull ache in her left calf, accompanied by a strange feeling of warmth. She brushed it off, thinking she'd just sat too long or perhaps pulled a muscle. However, the discomfort lingered, and soon, her leg began to swell slightly. Her daughter, noticing her mother's discomfort and the subtle changes in her leg, urged her to see a doctor. It was a good thing she did, because that seemingly innocuous sensation was a critical clue, pointing to a potentially life-threatening condition. In this article, we are going to explore the single crucial sensation in your legs that demands immediate medical attention, a sensation that could be a silent harbinger of deep vein thrombosis, or DV. By the end, you won't just understand the gravity of this condition, you'll discover the proactive steps you can take to protect your health and the well-being of those you care about. As someone who has spent years immersed in the study of wellness and the subtle language our bodies speak, I can tell you that Martha's story is a powerful reminder of how important it is to listen to these cues. It's not about inducing fear, but about empowering you with knowledge to make informed decisions for your health. The insights I'm about to share are drawn from extensive research and observations concerning the well-being of individuals in their later years. If you find this information valuable, please let me know by commenting number 1. If not, comment number 0 so I can provide better content for you. Now let's delve into the core of what this critical sensation truly signifies and why it demands your immediate attention. The singular sensation in your legs while sitting that warrants immediate medical consultation is a persistent, unexplained pain or tenderness, often described as a cramp or soreness, accompanied by swelling, warmth, and redness in one leg, particularly in the calf or thigh. This combination of symptoms is a strong indicator of a deep vein thrombosis, or DVT, a condition where a blood clot forms in one of the deep veins, usually in the leg. This isn't just about discomfort, it's about a serious medical emergency that requires prompt action. Think of your circulatory system as a complex network of highways and roads. Arteries carry oxygen-rich blood away from your heart, and veins bring deoxygenated blood back to it. Deep veins are the major highways, located deep within your muscle. When a clot forms in one of these highways, it obstructs blood flow, leading to a dangerous backup. This blockage can cause the symptoms you feel. The reason this is so concerning is not just the clot itself, but the potential for a piece of that clot to break off and travel through the bloodstream to your lungs, causing a pulmonary embolism, PE, which can be fatal. Imagine Sarah, 68, who had just returned from a long flight. A few days later, she started feeling a continuous dull ache in her right calf that felt different from a typical muscle cramp. It was localized, not spreading, and when she touched her calf, it felt warmer than her other leg. She also noticed a slight puffiness around her ankle and calf. Initially, she thought it was just post-travel fatigue, but the pain persisted even when resting, and the swelling became more noticeable. Sarah's intuition, combined with the escalating symptoms, led her to contact her doctor. This swift action was crucial. Her doctor quickly recognized the potential for DVT based on her symptoms and recent travel, a known risk factor. They immediately scheduled an ultrasound, which confirmed the presence of a deep vein clot. A sluggish blood flow due to prolonged immobility, damage to a blood vessel, or a tendency for blood to clot more easily are all factors that can contribute to DVT formation. The actionable advice here is to never ignore a persistent, unexplained leg pain, especially if it's accompanied by swelling, warmth, or redness. If you experience these symptoms, particularly after long periods of sitting, such as a long car ride or flight, or if you've recently had surgery or have other risk factors, do not wait. Seek medical attention immediately. Early diagnosis and treatment are critical to preventing serious complications like a pulmonary embolism. Even if it turns out to be something less serious, it's always better to be safe than sorry when it comes to your circulatory health. Believe it or not, the circumstances under which this sensation appears are almost as important as the sensation itself. While DVT can occur in anyone, certain situations significantly increase your risk, making that seemingly innocuous leg sensation a much louder warning. Prolonged periods of immobility are a primary culprit. When you sit for extended durations, especially with your legs bent at the knees, the blood flow in your deep leg veins slows down. This sluggish flow allows blood to pool, increasing the chances of a clot forming. Consider John, a 75-year-old who loved to binge-watch television series. He would often sit for hours on end, rarely getting up. One evening, after a particularly long viewing session, he felt a persistent throbbing in his left calf, coupled with a noticeable warmth to the touch and a slight discoloration of his skin. He initially attributed it to simply being stiff from sitting. What he didn't realize was that his sedentary lifestyle, combined with the prolonged static position of his legs, was creating a perfect storm for a DVT. This risk is compounded for individuals who have recently undergone surgery, especially orthopedic procedures involving the hips or knees, as both the trauma of surgery and the subsequent immobility can contribute to clot formation. Even long car rides, bus trips, or airplane flights, where you're confined to a small space with limited leg movement, can elevate your risk. Furthermore, certain medical conditions, such as cancer, heart failure, and inflammatory diseases, can increase blood clotting tendencies. Obesity and a family history of DVT also play a significant role. Imagine Susan, 65, who was recovering from knee surgery. Despite her doctor's warnings about DVT prevention, she found herself spending most of her days in bed, reluctant to move due to pain. A few days post-op, she noticed a dull ache and swelling in her operated leg, much more pronounced than the usual post-surgical discomfort. Her nurses, trained to spot these signs, immediately alerted the doctor. Susan's immobility, combined with the surgical trauma, put her at high risk. The actionable advice here is to be acutely aware of your risk factors. If you anticipate prolonged periods of immobility, whether due to travel, surgery, or a sedentary lifestyle, take proactive steps. Get up and move around frequently, even if it's just for a few minutes every hour. Perform leg exercises while sitting, such as ankle circles and calf raises, to keep blood flowing. Stay hydrated, as dehydration can thicken the blood. If you have known risk factors, discuss preventive measures with your doctor, which might include compression stockings or anticoagulant medication. Understanding these predisposing circumstances elevates the importance of that seemingly minor leg sensation from an annoyance to a critical warning. If you are still reading and finding these lessons useful, please comment number 3 below to let me know you are on this journey with me. Thank you for your valuable time. Just as the circumstances matter, the exact nature of the discomfort itself offers crucial clues. It's not just pain. It's often a specific type of pain that should raise an immediate red flag. The pain associated with DVT is frequently described as a persistent, deep ache or cramp, often localized in the calf or thigh. Unlike a muscle cramp that might come and go or respond to stretching, DVT pain tends to be more constant, sometimes worsening with walking or standing, but often present even at rest. It's not typically sharp or shooting like nerve pain, nor is it the generalized soreness you might feel after a strenuous workout. Instead, it's a dull, heavy, or tender sensation that can be quite unsettling. Imagine Miss Henderson, 70, a keen gardener, who one afternoon felt a persistent heavy ache in his right calf that wouldn't subside. It wasn't the usual muscle fatigue he felt after hours in the garden. This was different, deeper, and more constant. When he pressed on his calf, it was tender, almost bruised feeling, even though he hadn't bumped it. This distinct sensation, combined with a noticeable swelling in that leg compared to the other, prompted his wife to insist he call their doctor. The tenderness to touch is a particularly important symptom. It's often localized to the area of the clot, making the affected part of the leg feel sore or painful even with light pressure. This tenderness isn't always obvious and might require you to gently touch and compare both legs. Furthermore, the skin over the affected area might feel warmer to the touch than the surrounding skin or the opposite leg. This warmth is due to the inflammation caused by the blood clot. You might also notice a reddish or bluish discoloration of the skin, though this isn't always present and can be subtle. The swelling, which we've mentioned, is another key indicator. It can range from subtle puffiness around the ankle to significant enlargement of the entire leg. Often the swelling will be unilateral, meaning it affects only one leg, which is a major differentiating factor from general fluid retention, edema, that usually affects both legs. Consider Eleanor, 62, who noticed her left ankle was slightly puffy one morning. By evening, her entire calf felt tight and looked noticeably larger than her red calf. There was no specific injury, just this unexplained swelling and a dull ache. She tried elevating her leg, but it didn't improve. This persistent, unilateral swelling, combined with the dull ache, immediately made her think of DVT, prompting her to seek medical help. The actionable advice is to pay close attention to the characteristics of any leg discomfort. Is it constant? Is it tender to the touch? Is it accompanied by warmth or swelling, especially in only one leg? Don't dismiss these symptoms as minor aches and pains, particularly if they are persistent and unexplained by recent activity or injury. A careful self-assessment of these symptoms, coupled with an understanding of your personal risk factors, empowers you to recognize when something truly warrants immediate medical evaluation. Moving from the specific nature of the symptoms, it's profoundly important to understand why this one sensation, or rather this cluster of sensations, is so critical. The danger of DVT lies not just in the discomfort it causes, but in its potential to trigger a far more severe life-threatening condition, a pulmonary embolism, PE. This is the terrifying complication that makes prompt medical attention absolutely non-negotiable. A pulmonary embolism occurs when a piece of the blood clot, known as an embolus, breaks off from the deep vein in the leg and travels through the bloodstream to the lungs, where it can block one or more pulmonary arteries. These arteries are responsible for carrying blood to your lungs to pick up oxygen. When they are blocked, a part of your lung can be deprived of blood flow, leading to serious consequences. The symptoms of a PE can include sudden shortness of breath, chest pain that worsens with deep breathing, rapid heart rate, lightheadedness or dizziness, and coughing, sometimes with blood. These symptoms can be acute and terrifying. Imagine David, 70, who had been experiencing a dull ache and slight swelling in his left calf for a couple of days. He thought little of it until, one morning, he suddenly felt a crushing pain in his chest, became severely short of breath, and felt lightheaded. He immediately called for help. This was a pulmonary embolism, directly resulting from the DVT he had dismissed. Thankfully, he received emergency medical attention, but his story underscores the immediate and grave danger. This is why the leg sensation we're discussing is such a critical early warning. It's your body's alarm system signaling a potential crisis brewing. The clot in your leg might not feel life-threatening, but its potential to migrate to your lungs is what makes it so dangerous. It's a silent assassin, often giving only subtle warnings before striking with full force. Many people who experience a PE never even knew they had a DVT because they ignored or misattributed the initial leg symptoms. The swiftness with which a DVT can turn into a PE is unsettling, which is why there's no room for a wait-and-see approach once these specific leg sensations manifest. The actionable advice here is to view these leg symptoms not as isolated discomforts, but as potential harbingers of a far more serious internal event. Understanding the direct link between a DVT and a PE should instill a profound sense of urgency. If you experience the leg symptoms, seek medical help. If you then develop symptoms of a PE, call emergency services immediately. Educating yourself and your loved ones about this critical connection can literally be a matter of life or death. If you are still reading and finding these lessons useful, please comment number 5 below to let me know you are on this journey with me. Thank you for your valuable time. Beyond the immediate danger, there are also significant long-term consequences of an untreated DVT, which further emphasize the importance of recognizing that critical leg sensation. Even if a pulmonary embolism is avoided or successfully treated, an unaddressed DVT can lead to chronic issues that severely impact your quality of life. The most common long-term complication is post-thrombotic syndrome, PTS, also known as post-phlebitic syndrome. This condition occurs when the DVT damages the valves within the affected vein. These valves are crucial. They act like one-way gates, ensuring that blood flows efficiently back up to the heart and doesn't pool in the legs. When these valves are damaged by a clot, they can no longer function properly, leading to chronic venous insufficiency. This means blood flow becomes inefficient, causing long-term problems in the affected leg. The symptoms of PTS can range from persistent swelling, pain, aching, and heaviness in the leg, to more severe issues like skin discoloration, often a brownish tint, itching, and even the development of painful skin ulcers that are difficult to heal. Imagine Maria, 73, who had a DVT several years ago, but delayed seeking treatment because she thought her leg pain was just arthritis. While she eventually received treatment and avoided a PE, she now lives with constant leg pain, chronic swelling, and a painful ulcer on her ankle that frequently flares up, severely limiting her mobility and enjoyment of life. This is the reality of PTS, a direct consequence of an untreated or poorly managed DVT. The damage to the vein valves is often permanent, meaning that PTS can be a lifelong condition, significantly reducing independence and well-being. It can make everyday activities like walking, standing, or even sleeping comfortably a challenge. The pain and discomfort can be debilitating, and the skin changes and ulcers can be not only physically painful, but also emotionally distressing. Furthermore, a history of DVT increases your risk of developing future DVTs, highlighting the importance of understanding the root causes and engaging in preventative measures. The actionable advice here is to understand that the implications of DVT extend far beyond the initial acute event. Prompt diagnosis and appropriate treatment are not just about preventing a PE, they are also about minimizing the long-term damage to your veins and preserving your quality of life. If you have had a DVT, diligently follow your doctor's recommendations for managing the condition and preventing recurrence, including wearing compression stockings and taking prescribed medication. For those who experience the initial leg sensation, recognizing it early and seeking help can be the difference between a temporary health scare and a chronic, debilitating condition. Prioritizing your vascular health is an investment in your future well-being. Beyond understanding the symptoms and risks, knowing what to expect when you seek medical attention for this critical leg sensation is crucial. Your proactive approach in contacting a healthcare professional is the first and most important step, and knowing what comes next can help alleviate anxiety and ensure you receive timely care. When you report symptoms suggestive of DVT, your doctor will likely perform a thorough physical examination, looking for the telltale signs we've discussed: swelling, tenderness, warmth, and discoloration in the affected leg. They will also ask about your medical history, including any risk factors for DVT such as recent surgery, prolonged immobility, a history of cancer, or family history of blood clots. However, physical examination alone is not enough to definitively diagnose a DVT. The gold standard for diagnosis is imaging. The most common and accurate diagnostic test for DVT is a duplex ultrasound of the affected leg. This non-invasive test uses sound waves to create images of your veins and blood flow, allowing the doctor to visualize any clot. It's quick, painless, and can usually be performed in an outpatient setting. In some cases, a blood test called a D-dimer test may be performed. D-dimer is a protein fragment that is produced when a blood clot breaks down. Elevated D-dimer levels can indicate the presence of a clot, but this test is more useful for ruling out DVT in low-risk individuals rather than confirming it, as other conditions can also cause elevated D-dimer levels. If a DVT is diagnosed, treatment will typically involve anticoagulant medications, often referred to as blood thinners. These medications do not break up existing clots, but they prevent new clots from forming and stop existing clots from growing larger, allowing your body's natural processes to gradually dissolve the clot over time. Common anticoagulants include warfarin, direct oral anticoagulants DOACs, like rivaroxaban, apixaban, and dabigatran, or injectable medications like heparin. Your doctor will determine the most appropriate medication and duration of treatment based on your individual circumstance. In some rare and severe cases, other treatments might be considered, such as thrombolysis, medications to dissolve the clot, or the insertion of a vena cava filter to prevent clots from traveling to the lungs. But these are generally reserved for specific situations. Imagine Thomas, 69, who experienced the characteristic leg pain and swelling. He called his doctor, who promptly ordered a D-dimer test and then a leg ultrasound. The ultrasound confirmed a DVT, and Thomas was immediately started on an anticoagulant. He received clear instructions on how to take the medication, what side effects to watch for, and the importance of regular follow-up appointments. His quick action and adherence to the medical advice ensured a positive outcome. The actionable advice is to not hesitate in seeking medical attention if you suspect DVT. Be prepared to provide a detailed account of your symptoms and medical history. Trust your healthcare providers and follow their recommendations for diagnostic tests and treatment. Understanding the diagnostic process and treatment options can help you feel more empowered and less anxious during what can be a concerning time. Early and accurate diagnosis, followed by appropriate treatment, is your best defense against the immediate and long-term consequences of DVT. If you are still reading and finding these lessons useful, please comment number 6 below to let me know you are on this journey with me. Thank you for your valuable time. Beyond treatment, a significant aspect of managing the risk associated with this critical leg sensation lies in understanding and implementing effective prevention strategies. While some risk factors like genetics or recent surgery are beyond your immediate control, many others can be mitigated through conscious lifestyle choices and proactive measures. The cornerstone of DVT prevention is movement and activity, especially if you have an increased risk. As we've discussed, prolonged immobility is a major contributor to clot formation because it slows blood flow in the leg veins. Therefore, the actionable advice here is to avoid long periods of sitting or standing still. If you are on a long flight, car ride, or bus journey, make it a point to get up and walk around over an hour or two. Even if you can't get up, perform simple leg exercises while seated. These include ankle circles, where you rotate your ankles clockwise and counterclockwise, and calf raises, where you lift your heels off the floor while keeping your toes down, engaging your calf muscles. These movements help to pump blood through your veins. Imagine a group of friends, all in their late 60s, embarking on a cross-country road trip. Sarah, having learned about DVT, insisted that they stop every 2 hours to stretch their legs and walk around the rest stop. She also led them in doing ankle exercises during the driving segment. Her friends initially chuckled, but by the end of the trip, they appreciated feeling less stiff and more energized, unknowingly reducing their DVT risk. Hydration is another crucial element. Dehydration can make your blood thicker, increasing its propensity to clot. Therefore, ensure you are drinking plenty of water throughout the day, especially when traveling or during periods of reduced activity. Avoid excessive alcohol and caffeine, as these can contribute to dehydration. Maintaining a healthy weight is also vital. Obesity is a significant risk factor for DVT because excess weight puts pressure on the veins in the pelvis and legs, making it harder for blood to flow back to the heart. Incorporating regular physical activity into your daily routine, such as walking, swimming, or cycling, not only helps with weight management, but also promotes healthy circulation. If you are preparing for surgery, discuss DVT prevention with your healthcare team. They may recommend specific measures like compression stockings, which apply gentle pressure to your legs to keep blood flowing, or low-dose anticoagulant medications before and after the procedure. If you have a family history of DVT or a personal history of blood clots, ongoing discussions with your doctor about long-term prevention strategies are essential. This might involve lifestyle adjustments, a closer watch on your health, or even long-term anticoagulant therapy if deemed necessary. The emphasis on prevention cannot be overstated. It empowers you to take control of many aspects of your health and significantly reduce your risk of experiencing that alarming leg sensation and its dangerous implications. Proactive steps, no matter how small, contribute immensely to your overall vascular health and well-being. Finally, while recognizing that critical leg sensation and taking preventative measures are paramount, cultivating a proactive mindset towards your overall health and well-being is the ultimate defense. This extends beyond just DVT awareness and encompasses a holistic approach to aging gracefully and powerfully. It's about listening to your body, seeking knowledge, and engaging actively in your healthcare journey. Many individuals tend to normalize new aches, pains, or unusual sensations as simply getting older. However, a truly proactive mindset challenges this notion. It encourages curiosity about your body's signals and a willingness to investigate when something feels off. This isn't about being hypervigilant or anxious about every minor discomfort, but rather developing a discerning awareness of what is typical for your body and what constitutes a deviation that warrants attention. Imagine Robert, 77, who used to dismiss any new symptom as just age. After learning about the importance of early detection for various conditions, he shifted his perspective. Now, if he experiences a persistent or unusual sensation, he makes a note of it, observes if it changes or worsens, and doesn't hesitate to discuss it with his doctor during his regular checkups, or sooner if it's concerning. This shift in mindset from passive acceptance to active engagement is incredibly empowering. It means taking responsibility for your health, not just delegating it entirely to medical professionals. It involves staying informed about common age-related conditions, understanding your personal risk factors, and being an active participant in decision-making regarding your care. It also includes adopting a lifestyle that supports overall vascular health, which naturally reduces the risk of DVT and many other chronic conditions. This means prioritizing regular physical activity, maintaining a balanced diet rich in fruits, vegetables, and whole grains, managing chronic conditions like high blood pressure or diabetes, and avoiding smoking, which severely damages blood vessels. Furthermore, cultivating strong social connections and managing stress are also crucial components of this proactive approach, as they contribute to overall well-being and resilience, indirectly supporting your physical health. A positive outlook, coupled with a commitment to lifelong learning about your body and health, can make a profound difference in how you experience the later decades of life. The actionable advice here is to become an advocate for your own health. Trust your instincts when something doesn't feel right. Don't be afraid to ask questions, seek second opinions, or research reliable health information. Empower yourself with knowledge, and take consistent, small steps towards a healthier, more informed lifestyle. Your body sends you signals every day. Learning to interpret them and respond effectively is one of the most powerful skills you can develop for a long, healthy, and vibrant life. So, what have you learned so far about that critical leg sensation and its implications? We've explored how a persistent, unexplained pain or tenderness, often accompanied by swelling, warmth, and redness in one leg, especially in the calf or thigh, can be a warning sign of deep vein thrombosis. We've discussed the circumstances that increase your risk, the specific characteristics of the discomfort, and the profound danger of a pulmonary embolism, along with the long-term consequences like post-thrombotic syndrome. And finally, we've emphasized the vital role of prevention and cultivating a proactive mindset towards your health. What is one specific action you plan to take based on the information you've gained today? Is it committing to more movement during long periods of sitting, being more attentive to any unusual leg sensations, or scheduling a discussion with your doctor about your DVT risk factors? Please share your answer in the comments below. Your journey and your insights are valuable to this community, and sharing your intentions can inspire others. And if this article has resonated with you and you believe it can help someone else, I encourage you to share it widely with friends, family, or anyone who might benefit from this crucial wisdom. Thank you for reading, and remember to always listen to your body, empower yourself with knowledge, and live your best life, filled with health, vigilance, and well-being.